Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. I'm proud to announce that this presentation was accepted in the Heart and Diabetes Conference that went on in Los Angeles, California. So the title of our work was Gender Modifying the Effect of Rheumatoid Arthritis on Overall Mortality. So the idea was that, of course, first of all, we wanted to see if their rheumatoid arthritis had an effect on life expectancy and if there's premature mortality. And the answer you'll find out at the end. Secondarily, if having being male or female, that has an effect on what rheumatoid is doing in the body, wreaking havoc in the body. So to see if it's males or females. Just to give you an introduction here, rheumatoid arthritis is an autoimmune disease, as we know, and that affects approximately 1% of the population, and that's pretty significant. If you think about epilepsy, there's about 1%. And when you start thinking about how many people it's affecting, then it makes more sense. Goal of treatment of RA is to control the inflammatory response in synovial fluid and to prevent joint injury. I'll bring this and tie this to coronavirus COVID-19, in that COVID-19 was causing cytokine storm and inflammation. So that was the difference between if the patient was going to be having complications or if it's going to be mild. So this cytokine storm, of course, this inflammation is in a grander scheme in long term. So that's why it's so difficult to measure. DMARDs are non-biologic agents like methotrexate. And these are disease modifying, and it's part of it. You can look it up. There's also biologics, they're called tumor necrosis factor inhibitors, and these are really effective treatments. So if you're having severe rheumatoid flares, then go to your doctor and ask about biologics. Um, and then biological pathways were especially a concern globally. Anyway, so it's a prevalence of selected autoimmune diseases, which is way higher. And then kind of showing the pathophysiology of what are some things like chronic pain, heart disease, all of these factors are leading to mortality. So understanding if rheumatoid arthritis affects overall mortality and if people are not living as long. This was part of the National Health and Nutrition Examination Survey, and this actually followed people all the way from 1999, 2010, all the way into 2015, December 31. So there was a linked mortality file that was used in order to understand the long-term effects of rheumatoid arthritis on overall mortality. So in this pyramid, in this triangle, we're showing all-cause mortality at the end, rheumatoid arthritis above that, creating all-cause mortality. But then the third factor is gender, and that's the main question. Are males experiencing more mortality after rheumatoid arthritis, or females? And that is the main question. So I had this whole table with covariates and whatnot. It's beyond the scope of the description here. The chart is busy anyway. But the main meat and potatoes in the study is that there was indeed a higher mortality. Actually, I believe at least two times mortality. Higher mortality if people had RA versus no RA. Now, looking at males versus females, females actually have worse outcomes than males. This is very important to know. And it's because our study shows that there's definitely consistent pattern of 34% increased risk of mortality. So 34% among females, there's an increased mortality from rheumatoid arthritis. And then, of course, there may be a stigma affecting medication adherence negatively. And then looking at rheumatoid arthritis in some ways, how there's complementary principles like alternative therapy, psychological intervention, quality of life, doctor-patient interaction, effect of chronic pain or on emotional state, psychosexual disorders, sleeping disorders, psychological stress, and anxiety and depression. So these are all the elements that are connected to rheumatoid arthritis. Um, there's also complementary and alternative medicine that's used for this as well. So I hope some of this has made sense. The take-home message is that you have to kind of go through specialized target populations and see which are the most frequent. This is how big data is best employed. Thank you for listening.